Lawmakers and health experts say that the country is in the middle of an overdose epidemic. The U.S. Drug Enforcement Administration reports that drug overdose deaths increased by 37% in Pennsylvania last year. More than 4,600 people in this state died from overdoses last year, and some of the largest increases were in the rural counties. And all of those cases are putting a strain on the medical examiner's office.
Carl Williams, the chief medical examiner of Allegheny County, will appear on this week's KDPG Sunday edition and weighed in on the overdose epidemic during today's taping. Ralph Iannotti has the story new at 6.
The numbers are devastating here in Allegheny County and around the country.
We had 640 overdose last year, up from 300 2 years ago. We've doubled the number of overdoses.
And they continue to climb every year.
It's the greatest public health crisis of our generation.
There's hardly a family anywhere that hasn't been somehow affected by the opioid epidemic. And medical officials say the pattern of abuse is changing for the worse.
Younger age group is going directly to these drugs without intervening addiction to heroin or prescription drugs.
Williams says virtually all fentanyl is coming from China through Mexico, and users have no way of knowing just what combination of drugs are in a stamp bag when they buy it.
We have an increasing number of cases in young people, less than 20, that snort a powder, having no idea what it is, and are dead, and it's fentanyl.
Williams says the idea of using drugs has become more acceptable, and addiction needs to be treated as a disease, with education starting as early as grade school.
It's a disease, and it needs to be approached as a disease in terms of early diagnosis. Children's Hospital Pittsburgh is starting to carry knowledge about it into grade schools now. I mean, it needs to start extraordinarily young.
And with the increase in addiction and deaths comes a stretching of resources.
We're pushing the load for the pathologists, we're pushing the load for the toxicologists, we're pushing the load for the drug chemists that look at all of the seizures. Everything's being stressed in the office.
You can see the full conversation with Dr. Carl Williams on the KDPG Sunday edition. Ralph Iannotti, KDKA-TV News.